Thanks. Thank you. So I want to introduce Haileigh. She's an early years consultant for Nova Scotia Health, Public Health and Provincial Science and Systems team. And fun fact, actually, when I was looking at Nova Scotia, it actually means New Scotland. So she's from New Scotland, Nova Scotia. She is a registered dietitian with a Master's of Public Health, specializing in public health policy and global health. In a role, she leads the provincial approach to implementing baby-friendly and public health and supports the policies, programs, and initiatives that aim to improve infant and young child feeding in Nova Scotia. Haileigh's passionate about using public health strategies and approaches to scale up equity orientated BFI in community settings. Okay, so Haileigh, take it away.
Okay, thank you, Margaret. And thank you for inviting me to speak today. I always get excited talking about this stuff. So if I am kind of running out of time near the end, someone please feel free to flag me once you get going. Sometimes there's no stopping. So yeah, I'm excited to talk to you today about how we are building capacity in Nova Scotia, and particularly in public health, on scaling up our implementation of BFI. And first, I also wanted to do my own land acknowledgement. Interestingly enough, I'm actually visiting in Toronto when I'm calling in from this meeting. So how fitting to be speaking to you folks in Ontario, and also happen to be here working today myself. So I wanted to acknowledge the land that I'm working from today as being the traditional territory of several nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, and the Haudenosaunee, and the Wendat's people. And also wanted to recognize that this land is home to many First Nations, Inuit, and Métis peoples that have always and continue to live and care for and hold such a deep and unique interconnected relationship with the land that has been ongoing since the beginning of time. And I just wanted to express gratitude to be on this beautiful land and in this space, sharing it with you all, and encourage us to also take, our own reflections on our collective responsibility in dismantling systems of oppressive power and their historical and ongoing impacts on both land and people, and within the context of our work to improve infant and young child feeding practices and in our BFI work in the spirit of reconciliation. So just to start off on a little bit of our context in Nova Scotia, for those of you who might not be familiar, just to situate some of what I'm going to talk about today within our health system. So as some of you probably know, we're a very small province, but we're growing quite rapidly, actually, and we've surpassed a population of over 1 million, and our annual birth rate is growing to nearly almost 8,000. So certainly more babies are being born in Nova Scotia than I think they ever have been. And about 10 years ago, Nova Scotia Health, which is our provincial health authority, was formed through an amalgamation of our 9 district health authorities. So we've been kind of operating in this provincial health authority model for some time now. And that's the same with our public health program. So we are a provincial program, just like other areas of Nova Scotia Health. And so we set our standards and planning provincially, but we implement locally in each of our 4 different health zones that Nova Scotia Health is divided into. So our provincial public health teams, which is where I myself am situated within the science and system performance team, they kind of support the planning, implementation, and evaluation of our public health programs and activities at the provincial level. But then we also have each of our zones that are also split up into our core program areas. So we have early years, which is, again, where I'm situated in, healthy communities, health protection, and emergency preparedness. And our early years program has a suite of services. So we offer our direct home visiting and community-based services through our Healthy Beginnings program, which is our kind of nursing services. And then we have an enhanced home visiting program delivered by community home visitors. And then we've just started implementing our nurse family partnership program, which is a more intensive public health nursing home visiting program. So our early years programs are kind of our core kind of community-based services for the early years, but we also have prenatal, labor and delivery, postpartum care offered in our hospitals across the province through the Nova Scotia Health Women and Children's Health Program. And we also have IWK Health, which is our largest and only tertiary perinatal care center where, half our births are really delivered each year. And so currently in Nova Scotia, the state of BFI, so we've got 4 hospitals that are BFI designated, but currently no designation within our public health services. And so the rest of our hospitals and community health services are certainly working towards that. And definitely I'm hoping that in a few years, give us a few years time and we'll change that for our public health settings. And I also wanted to provide just a bit of context on what infant feeding actually looks like in Nova Scotia and just some of the challenges we've experienced, because this is such a big reason as to why we've moved forward with trying to build our capacity and kind of ramp up the implementation of evidence-based initiatives. So when we look at, the available national surveillance data that we have, one piece of information that always seems to strike me, I guess, is that when we look at the variables that are associated with early breastfeeding cessation or not meeting, our global infant and young child feeding recommendations, simply living in Atlantic Canada is a risk factor, is associated with not breastfeeding for the recommended durations and whatnot. And so for me, that's kind of where a lot of my passion comes from, is like really trying to look at how can we scale up the implementation of practices that we know are shown to improve infant feeding, and look at the whole environment in Atlantic Canada and in Nova Scotia particularly. So Nova Scotia, we don't have the most robust data, but so this is, all we have to really kind of draw on. But we know we've consistently had lower breastfeeding initiation duration and exclusivity rates than other parts of the country. And there was also an interesting analysis of CCHS data that's just come out from looking at data from 2015 to 2018, that's also shown that living in Atlantic Canada, you had higher odds of early introduction of solid foods. So, we've experienced challenges in that way. And certainly, like other provinces and territories in Canada, we've seen a rise and a high prevalence of infant food insecurity becoming more and more visible. And, we've observed the breastfeeding paradox, where we have families who would be most likely to benefit from breastfeeding are least likely to breastfeed. And so why is that? And, our child poverty rates have been quite high, particularly among children under the age of 6. And so we know that those are factors that are quite potent barriers to successful breastfeeding and meeting optimal infant and young child feeding practices. So that's kind of the backdrop of where, we look at our program and look at our implementation. This is kind of some of the pieces within the environment. And so I also wanted to touch on too some of the historical and ongoing challenges that we've experienced in Nova Scotia related to ability to implement BFI or improve these practices. And I don't highlight these necessarily to say, oh gosh, look how much work we have to do. I highlight them as a way to actually to provide context. So when I tell you about some of the expansion pieces that we have, to look at these gaps and these barriers and see how we're actually trying to address them. Because, when I was doing this presentation and kind of looking at what the core, challenges we've experienced, I actually do feel very proud of what Nova Scotia has been doing to actually try and look at these bullets on the slide and act on them. So, we've had, a lack of robust provincial data and monitoring systems that extend beyond the immediate postpartum. So we've had data that's been collected through our Haileigh perinatal database for decades, but we don't see the full picture after hospital discharge. And so that has been a key challenge. We also know in Nova Scotia, not all parts of the province have the same access or availability of infant feeding and lactation supports. And this looks differently within our rural and urban context. And so we also know we've had just some gaps in terms of prenatal education available to families. And we know that's so important for preparing people for birth and for, bringing baby home and to really set up infant feeding well. And we also had one of the biggest things that kept coming up for Nova Scotia, and I know, likely for many of you too, but just having BFI positioned as this side of desk work. And so, it was just, it was led by people who were so passionate and skilled, but not fully able to dedicate the amount of time that's needed to fully operationalize BFI within our organizations and our communities. So that was a big thing that really drove, I think, some of this action forward. And we also know too, like there's been identified a greater need for some provincial consistency in our health messaging, but also in the coordination of some of our infant feeding supports as well. And we also know too, like most other places, even just building that supportive culture and environment on public perception around infant feeding and breastfeeding has been a big piece. So these were things that have been kind of identified over time, particularly amongst our, frontline providers, by communities, management and things like that. So what are we doing about it? And what did we do about it? So our public health and early years leadership really saw a big opportunity we had some recent government interest in really investing within the healthcare system. And so our leadership took that window of opportunity to really push for public health investment and public health expansion within that to do our, health promotion and preventative work. And so, and really sometimes that is what it is, right? Like you have a window of opportunity and sometimes you might not always have it, but if you can learn to recognize when those opportunities come up so that way you can capture it when you can, that's a super important piece. And so really for us, where we have been able to expand some of our services and implementation supports has been through a larger, more broader early years expansion project within public health. But through this, our early years leadership saw the opportunity to make sure that BFI implementation and our infant feeding supports were included within that overall early years expansion. So this was really key in allowing us to build the structure in public health that we want to see, and making sure that what was being asked and what we were trying to expand also aligned with any other aspects of political interest, leadership interest, and making sure that we had, our ducks in a row, having the evidence put together and multiple forms of evidence too, right? Like a lot of these changes did, like I mentioned, they really came from our people on the ground saying, this is a need and this is a gap. But luckily with BFI, it's so versatile in the sense that you can really relate some of this work to anything and really try and latch it on to any opportunity that you can. And it also really helped the argument in that because BFI is nationally recognized, it's globally recognized, and it's founded in this strong evidence that we know even from a global level, like, is looked at, updated. There's an additional level of accountability to that work too. So that also helped us kind of push some of this forward. And certainly to help do that, it was important to, build support from all levels and build buy-in from all levels and really identify like who the allies are within leadership spaces and frontline spaces and whatnot. And through this process, our public health leadership really did take a lot of care and consideration to ensuring that, when we're communicating the work of public health and communicating the work that we want to see, like how to tailor that specifically to each audience and really trying to think about, okay, well, what do decision makers care about? Like, what are the stories that people care about and that they want to hear, and how does that align with their interests? So that was a big piece in which our leadership level really used some core strategies to do that. And I also want to mention too, in some ways we had a pretty favorable situation where our leadership was really structured in a way that allowed for some of this decision making to be informed by those who really knew the context, really knew the evidence and the barriers that I, just mentioned. Because this helped to really get kind of buy-in from people, so when we're going forward in these changes, because it was coming from people within the organization and coming from what we had been identifying over years, it's a lot easier to have that buy-in when the changes do eventually happen. So yeah, and that works two ways. So I'll talk a little bit about that at the end. So, in some ways, your window of opportunity, it's great to have that leadership structure that is going to be there to listen and actually hear out what the ask is and hear you out when you're maybe trying to advocate for, funding or resources or things like that. But there's also a level two of trying to do that work to build that relationship with those folks. So that way, when the time comes, there is a path forward. So then just thinking about, what do we ask for? What are we moving forward with? So What became of some of that work to expand some of our early years resources and supports was a few different things that actually, I do believe like are going to be pretty big for our BFI implementation and scaling up our capacity. So one of the core pieces is we're now expanding more into the prenatal period and trying to provide more, like I said, a suite of services that are more designed to be proportionate to a family's unique needs. And stepping back into the prenatal period is going to be really big for us in terms of infant feeding, because we're going to be able to start building those relationships as public health earlier on and support infant feeding and informed decision making earlier on in the perinatal journey, which will hopefully help us get to that point where we are proactively addressing infant feeding challenges or concerns rather than only just being reactive. And so we also have been able to obtain more formal leadership commitment to achieve 100% BFI designation provincially in all of our public health zones. So the work for us over the next few years is figuring out how to do that, and trying to get to the point where all of our four health zones are BFI designated. And it'll be quite interesting for us because we are organized into health zones. That's kind of the way that we will be doing our designation process. So we're trying to look at this from a whole of community approach as well. So, it's not just one, maybe because it's in a zone, it's not just necessarily one public health unit or one smaller community, but it's looking at the zone as a whole and how are we doing towards BFI practices in all of those different communities that are located in that zone. So I'm pretty excited to see how we will move forward and shape up that. So really to do this, what we've also been able to get, and we have 2 positions hired right now and just waiting to hire the other 2. But we have dedicated health promoter positions. So these are called BFI health promoters. And there's one located in each health zone. And these positions are really there to do that implementation of BFI locally. And this work also is complemented by even my existing position provincially as our BFI lead. So this is also a new kind of implementation structure for public health. There's not, even though, like I said, we've been operating provincially for some years, this is kind of one of the first models, I guess, where you've had, a provincial team working so closely with a zone team, and I'll talk about that shortly as well. And we're also working with our epidemiologists to develop a provincial infant feeding surveillance system. So this will allow us to better understand our population rates. And, we're also working to create better evaluation structures to understand and measure our progress. So those pieces will, hopefully really address, the gaps we've seen in terms of like data and measurement and evaluating our progress. We've also started hiring for infant feeding specialist positions. So these will be multidisciplinary IBCLC positions. And these are really intended to complement the existing work that's happening in the zones right now and the existing infant feeding work that our nurses are providing and that other pieces of the health system are providing. But really with these positions, we're trying to expand access to community-based lactation support. And then be able to build that provider capacity across the system and have maybe more opportunity for engagement, working with partners and, things that, we might not have been able to do otherwise. So all these pieces are very exciting, and we're kind of in the early stages of some of these, but these are some of the core big infant feeding enhancements that we've seen that's come out of that work with their overall expansion projects. So I also wanted to think about too even, there was so much work to try and build our capacity and trying to have, our leadership working with government and working with all these different partners to be able to secure the resources that we needed to do some of this work. But then the task kind of now for us when we think about building our capacity is if you have these resources now, what do we do with it? How do we move forward? So we're in the stages now of thinking about, we know that we certainly don't need more evidence to tell us that when we provide skilled infant feeding support in a proactive and timely way, that it improves outcomes. That's very clear. But now we're just thinking about, okay, well, how do we design these and develop these new enhancements effectively to truly build capacity across the system? So one of the pieces that we've been trying to do at every opportunity is embed the BFI standards and that lens through all of our areas of work. So really just trying to avoid positioning BFI as, you know, a standalone project or a standalone initiative, but really it needs to be weaved through all of our early years and even public health more broadly, that work and that lens. So for example, one of the things we've been doing is we've been working closely with our evaluations team to look at, you know, when we look at our evaluation framework and developing indicators and measurement processes, embedding the BFI indicators within that. So that way it becomes something that as a system, we're measuring it. And so when you have something that's being measured and being reported on, you've then added a level of accountability that's really important for making sure that the work stays sustainable and stays consistent. So that's been a very interesting piece of work, and we're still working on it, but I'm very excited to see that start to shape up. And even to, you know, not even just with like, you know, formal reporting, but even just reporting structures for back to leadership about progress. Because when you have a platform to, you know, be able to report on your progress, again, there's a level of accountability there that people are expecting that to hear about the progress. And when you do have progress, you should definitely have the platforms where you can share it, because that's how we think about, you know, a lot of times it's not one-time funding or not one-time resources we need. We have to make sure that those stay ongoing. And so we've been trying to identify opportunities to find sustainability in everything that we're doing. So even though we have dedicated positions now to lead this work in the zones and provincially, we still are trying to make sure that, you know, as soon as a project or a task seems like it's going to rely on one person or maybe one position alone, let's rethink, rejig, and see how we can bring other folks into it so that, again, we still aren't creating a system where it's relying on one person in particular. And so I think a lot of this work has also led to some opportunities for us to take more of a systems approach for our BFI work. And so, you know, it's in the early stages, but we've been kind of working with other health systems partners to look at what is our provincial, you know, committee structures for BFI look like, to guide this work and, you know, identify areas where both public health and hospitals can work together, to try and think about, okay, like how could we be more effective with things? And I know, you know, just personally, like I've had conversations with folks where if we look at some of the tools that the BCC has put out recently to support us in implementation, like client surveys or chart audits, you know, we've had conversations of, you know, we should all be using the same tool, or we should try and find ways to work provincially, right? It doesn't make sense to have one area of Nova Scotia doing one thing and then another area doing another. Let's just find ways to, you know, kind of work smarter, not harder, I guess. And so the other piece to this too is we've really been trying to work at that. What does the provincial and local coordination look like? And then, you know, with this kind of BFI health promotion team that we're starting to build and curate is also trying to look at how do we integrate those health promotion lenses and strategies into all aspects of the BFI work, to kind of have more of a health equity oriented approach. And so I just wanted to share a little bit for how we're actually actualizing our kind of core BFI implementation team. And so, like I mentioned, this is kind of a new way to work together, but so we have myself, which sits as our provincial BFI lead. So this is really trying to provide like that, you know, content expertise, ensuring that we have provincial direction for some of this work. And then our BFI health promoters are really leading this implementation locally. And so holding those local partnerships, working with the staff really closely. And so this is, so far at least, has worked really well in terms of our regular connects. So we're trying to build in effective structures for, you know, the 5 of us to really work together closely. And so it's been great from both ends, whereas, you know, for us to work together, for them to always be able to ensure that the work they're doing locally still aligns with our provincial direction. But then for myself too, you know, working provincially, this is a lot, it's so much nicer to be able to understand the local context more, like when you have such closer connects to our local BFI leads. So this is something that has been working well so far, and we've been trying to look at ways on how to bring other folks into the work, or what some of this implementation structure looks like. But certainly, we also know that it's not just about implementing BFI, and to truly build up that capacity within a system means that it's not just about our early years team in public health. It's about kind of all of those core program areas. And like I mentioned, the other teams in public health have to be involved. And so again, working through this, but I also wanted to show a little bit about what this system for us has at least started to shape up and look like. So this is a diagram adapted from the Center of Implementation, their integrated implementation integrated systems framework. And so this is just an interesting way to look at it, I guess, because we've been spending a lot of time on just trying to figure out what our role clarity is at the different levels. So in order to have an effective implementation structure. So, because one of the first and most important pieces of building capacity and effective implementation is knowing who does what and then how they work together. So we kind of have our core support system, which is, like I said, our provincial BFI lead, and then our zone BFI leads. Then we kind of have our evidence synthesis and translation support from our provincial teams. And then kind of the whole change, like the main change system is really coming from bringing those folks in the zone together with the BFI health promoters to really lead the work. And of course, we always have our additional roles within the system, which, like I mentioned, is our other areas of public health that have been helping us along the way, leadership, our partners, which all kind of work together to, like I said, have the heart of the change and to make that impact we want to see for both of our families and our staff. So this is kind of the core pieces for at least our public health perspective on how we've been thinking about how we're implementing and kind of who's doing what. And so some overall lessons learned, I suppose, and I want to emphasize still very much learning along this journey, is it's so important when you're thinking about building capacity to scale up BFI and just thinking about relationships at all levels. And so I know personally, just, when you have those relationships with leadership or with government or whoever it is you are working for to, or working with to try and obtain maybe more resources or more capacity, having those relationships and that trust is so important to make sure that you are heard at all levels, and that you are also taking into context some of those other systems level pieces that might, you might need to pivot or might need to consider when you are thinking about different pieces of work you might want to try. And the other piece is just kind of adopting a no missed opportunities approach. It's important to kind of think about any opportunity could be an opportunity to promote BFI or to advance some of our infant feeding initiatives. And so learning on how to identify those and figure out ways, even if they're small, as long as they're leading us to the end goal, they're certainly worth taking. The other thing that we've been doing is really just looking at how do we continuously assess and work within a readiness for change. So even once you have some of these resources, we know that local context is so important when thinking about how to implement or when to implement certain parts of the BFI journey or certain projects. And so really trying to look at that and using the resources to understand the best timing and the best way to push work forward. And then I feel like this is the biggest one, that if I could emphasize anything, it would be this one, is to really try and work within a space of consensus. And so try and figure out, where do you have consensus, even if it's a little bit, even if it's just, okay, we can maybe start this project, but not this one, or, we can maybe go for this, but not that. If you can work within that space of consensus, you're going to be more likely to have the buy-in for some of this stuff. And so you can grow from there. Like, you can always start small and grow from there. And I think, and that's really been what I think has been promoted with BFI recently anyway, with the quality improvement approach on how do you just start somewhere and then build it up from there. And so we've seen a lot better success within that piece. So even if, you might not be successful in the initial ask, we'll just maybe think about pivoting and reflecting on, okay, well, if we can't do this, what can we do? So always having options within your back pocket. So really it's trying to be bold enough to ask for what you need, but also being flexible to adjust it based on some of these factors. Even if you might feel like you were unsuccessful. For example, we've just developed our provincial action plan for this year, but we'll probably, being realistic, we'll go into maybe some next year as well. And so within that, there's we created a situation where there's tons of options. So even if maybe one zone or one part of the province isn't ready to implement this project, well, that's fine because we have these ones that we could do. And we have, a variety of levels of pieces of work that could happen. So trying to think about, options so that way, if all of a sudden, you might want to do a certain project now or get a certain resource now, and maybe that's not the time, you still have other pieces of work that you can do. So it's not feeling like, oh, I was unsuccessful in this ask, when in reality, there's other ways to move it forward. And with some of this too, I like to think about this, if anyone's familiar with the Thomas Kilmann conflict model. And so it's got kind of 4 domains. So you've got like avoiding. So we're going to avoid this for now, but let's revisit later. Or competing. So go ahead and do it anyway. Collaborating. Hey, we can both get what we need. Or accommodating, where you're more so just, okay, let's save the relationship for now and we'll revisit it later. And so really just trying to think about where you are along, like when you've asked for more capacity or when you're trying to work to build it, trying to think about where you are along that spectrum, and pivoting as necessary. And I think too, if another lesson has just been, if you have the opportunity to do something similar and think about dedicated roles or other pieces of work that you might want to see investment in, is to just also be thoughtful on what roles you need and ensuring that you're thinking across the system when scoping out some of these positions. And again, I know I kind of mentioned it before, but really trying to use a systems approach. So bringing others into the work, even like I mentioned, the work with our evaluations team, when you bring everybody in, now it's a situation where, other people are applying that BFI lens too. It's not just us as BFI leads, it's other people are also engaging with that. We're checking in to say, hey, does this align with BFI? And so if you can kind of build that lens, within others within the systems too, it helps to just ensure it's more sustainable. So thank you. I probably maybe talked over my time or too fast, but I'm happy to take any questions. And here is my contact if anyone would like to get in touch with me later. And I also just wanted to point out too, we're developing a lot that's new in Nova Scotia right now, but we're not totally building from scratch, because I do want to recognize that there was a lot of foundational work laid by people in public health and in other parts of Nova Scotia who've really worked tirelessly to be advancing BFI here in the absence of even some of these enhancements that we have. So certainly have a good foundation.
Okay. Haileigh, that was amazing, and so much food for thought, so many words that speak with all of us as we kind of forge through to enable and support.